This is Jamal Taylor, or JT as he likes to be called, so that's how we'll refer to him from here on out. He was recently in a motor vehicle accident which left him with several injuries, in which a collaborative care team will be needed for him to make a full recovery.
So I'm the PCP. After working with JT at Northeast Family Health, we'll take a holistic team-based approach to his recovery. I'll monitor his concussion symptoms and coordinate with his athletic trainer for a safe return to play. For his shoulder, I'll refer him to orthopedics and ensure pain management and physical therapy are integrated. His dentist will handle his jaw injury, and I'll align with them on treatment. Regular updates among providers and communication with JT's family, especially Auntie Rosie, will help keep them informed and involved. By tracking progress, adjusting care as needed, and prioritizing patient safety, we'll support JT's medical, emotional, and social needs to help him achieve his dreams.
As JT's social worker, one of JT's biggest concerns is his financial situation, especially regarding medical bills, NIL contracts, and his ability to continue pursuing an MBA career. We'll work with JT and Aunt Rose to explore financial assistance options for his medical expenses, including insurance coverage, university resources, and possibly community grants for athletes recovering from injuries. Next, we'll coordinate with his healthcare team to ensure a smooth return to school and basketball, advocating for reasonable modification in his training and academic workload. JT is facing anxiety about his future, particularly in relation to his NBA dreams and comparison to his friend Casey, whose career ended due to injury. I'll connect him with a mental health provider who specializes in sports psychology to help him process these concerns and build resilience. I'll conduct regular home visits to check on JT's neurological status post-concussion, ensuring that there's no signs of worsening symptoms such as dizziness, headaches, or cognitive difficulties. I'll also educate his Aunt Rose on red flag symptoms that require immediate medical attention. Concerning his jaw injury, I'll assess his ability to eat and speak comfortably while coordinating with a speech therapist and dentist to ensure he maintains proper nutrition and oral hygiene. With his lingering shoulder pain, I will monitor for any signs of swelling or limited mobility that could hinder his rehabilitation while working closely with his physical and occupational therapist to track his progress. Additionally, since JT has a history of his hearing loss, I will check on his communication needs, ensuring he has access to assistive listening devices and is supported in his transition back to school and sports.
JT has a history of congenital hearing loss and has been having issues with hearing recently, so the first priority is scheduling a hearing evaluation at the ATSU Speech and Hearing Clinic to determine the best options moving forward. In the meantime, he would benefit from a pocket talker or personal amplifier as a temporary solution. JT has also reported intermittent tinnitus and listening fatigue, so we'll need to assess whether he would benefit from sound therapy or other audiology rehabilitation strategies to help manage these symptoms. Finally, we will work with his PCP, social worker, and the Truman States Disability Services to explore assistive listening devices and classroom accommodations.
Having treated him since childhood at Kirksville Dental Group, I'll collaborate with his PCP and the oral surgeon to ensure his recovery aligns with his concussion care. I'll also coordinate pain management and minimize stress on his jaw. Open communication with his healthcare team and Auntie Rose will help keep everyone aligned on treatment and expectations. My goal is a holistic, patient-centered approach, supporting JT's basketball career and tutoring. I'll track his progress, adjust care as needed, and prioritize his safety and well-being to protect his future opportunities.
As JT's oral and maxillofacial surgeon, my priority is proper jaw healing while minimizing complications. We'll assess his TMJ injury, determine if surgery is needed, and coordinate his recovery plan.
JT has limited jaw mobility and pain with movement and difficulty projecting his voice, which affect his ability to communicate effectively. As a speech and language pathologist at the Northeast Regional Medical Center, the immediate goal is to implement jaw exercises and compensatory speech techniques to improve clarity while reducing strain. We'll coordinate with his oral and maxillofacial surgeon and dentist on further evaluation to monitor his challenges and recovery. Swallowing is another concern, and right now he's on a soft diet due to pain when chewing, so we'll continue to monitor his progress to ensure he transitions back to normal texture safely. We'll work alongside his family, social work, and care team to meet his goals.
As JT's physical therapist, I will be sure to identify his therapy goals over the course of treatment and aid in providing pain remedies specifically to his jaw area and shoulder injury. With a diagnosis of temporomandibular joint dysfunction, or TMJ, twice weekly physical therapy in addition to postural correction and collaboration with other healthcare professionals will improve his quality of life. I will work closely with the occupational therapist and primary care physician to ensure that JT has access to necessary resources and referrals in hopes for JT to be able to return to his game with confidence, strength, and physical ability. As JT's occupational therapist, it is crucial that we address his immediate concerns, activities of daily living, and assuring a successful transition back to academic and social well-being following his mild traumatic brain injury. By coordinating occupational therapy sessions on a bi-weekly to weekly basis, we will properly address JT's need for cognitive and physical rehabilitation. Additional collaboration with the university's Learning Support Center and providing JT with academic accommodations for his post-concussive state and will also help with his psychosocial well-being.
As JT's athletic trainer at Truman State, I oversee his recovery, ensuring a safe return to play. His rehab plan addresses his concussion, shoulder strain, and jaw injury. For his concussion, he will follow return to play protocols, progressing from rest to full contact play under close monitoring. His shoulder rehab will focus on pain management, mobility, and strength, resuming overhead movements. For his jaw injury, I'll coordinate with nutrition staff to maintain his caloric intake and with his speech therapist for communication support. Beyond physical recovery, I'll monitor his mental well-being and keep him engaged with a modified training program. My goal is to ensure JT returns to peak performance safely and confidently.